the 44 counties that have enacted the Facility Improvement Financing Act, commonly referred to as FIF, collections have improved from 16.9 billion to 24.01 billion, surpassing their annual targets. For the period under review, the total health workforce across the 47 counties was 98,907, excluding those in national referral, faith-based, and private hospitals. This presents a 29% decline from the previous financial year of 149,447 workers in the health sector, which is majorly attributed to the loss of approximately 41,000 workers deployed under the United States government USG program, of whom 28,600 were frontline healthcare workers. Another reason for the decline is the transfer of county hospitals to national governments, specifically the Jaramogi Oginga Odinga Teaching and Referral Hospital. On health infrastructure, the number of registered and licensed public health facilities increased from 6,649 in the financial year 2024-25 to 6,740 in the financial year 2025-2026, reflecting improved compliance with health facility standards and licensing requirements. The total number of hospital beds increased by 2.9% from 47,950 beds to 49,324 beds. Critical care capacity also improved significantly, with intensive care units, ICU beds, increasing by 9% from 314 to 345, and HDU or high dependency unit beds are rising by 13% from 141 to 160, enhancing counties' ability to manage critically ill patients. The county ambulance fleet grew from 566. The county ambulance fleet, these are the number of ambulances, grew from 566 to 583. 175 public emergency departments received specialized emergency care training compared to 85 in the previous year, and 15 counties also completed the establishment of emergency dispatch centers for strengthening emergency response. Maternal deaths declined by 6.8% from 2,851 down to 2,656. Neonatal deaths fell significantly from 6,909 to 5,777. And teenage pregnancies decreased by 19.7%, reflecting progress in reproductive and maternal health interventions by county governments. Skilled birth deliveries dropped by 23% from 709,281 to 543,237. And fourth antenatal care, ANC visits, decreased by 19% from 459,489 to 368,585. This was attributed to change in policy on provision of these essential services in level 2s by SHA. Maternal and perinatal death surveillance and response, MPDSR, improved significantly, with all 47 counties conducting weekly monitoring compared to only 34 counties in the previous financial year. The total number of established primary care networks, PCNs, across the 47 counties now stands at 277, which is an improvement from 227 in the previous financial year. Cumulatively, across all the 47 counties, the total number of active community health promoters, CHPs, is now 107,821. County governments and national governments jointly continue with the payment of CHP's stipends. In finance and economic planning, county governments projected total revenue of 663.3 billion for the financial year 2025-2026, comprising of 234.33 billion, which is 37% for developmental expenditure, and 398.97 billion, 63% for recurrent expenditure. So county governments averaged 37% for development expenditure, 63% for recurrent expenditure, thereby meeting the Public Finance Management Act PFM requirement of allocating at least 30% of the budget to development. Revenue sources included 415 billion in equitable share, Kenya shillings 71.98 billion in additional allocations from the national government and development partners, what is commonly referred to as conditional grants, and 100.13 billion in projected on-source revenues.